COVID-19's Delta variant has hit the entire nation hard, but the numbers show Tennessee is bearing the worst brunt of all.
Yeah, 2 months ago, Tennessee's case rate per 100,000 people for the entire pandemic ranked 5th nationally at under 13,000, as you could see here in orange. But since the Delta's emergence, Tennessee is now in the lead, with more than 16,000 recently passing the state of North Dakota, which is that red line there.
Meanwhile, Tennessee has had the nation's highest 7-day rate throughout September. Take a look at this graph. It shows the 7-day rolling average of new cases per 100,000 people since mid-July. The yellow line is the U.S., orange is Tennessee's numbers, and red is Northeast Tennessee. As you can see, the rates were similarly low on July 13th, but Tennessee and our region have since moved far ahead of the current national rate.
Today, Northeast Tennessee reported 12 new COVID-19 related deaths and more than 500 new cases. Sullivan County has the most new cases by far, with nearly 200. Hawkins, Greene, and Washington counties in Tennessee have over 70. Carter County, 67. News Channel 11's Bianca Murray joins us live from our Kingsport newsroom.
Bianca, you spoke with a local lawmaker and a health leader today on COVID-19 trends in Tennessee and here in our region. What was their reaction?
Well, Josh and Sarah, both those officials I spoke with today told me the same thing. They're disappointed because this could have been prevented since Tennessee, as well as our region, have such low vaccination rates. Though it does not seem like we'll see any pressure from the state level to do anything about it.
Common sense says virtually every expert out there says the right thing to do is this vaccination. It prevents COVID or severely lessens it dramatically. Get a vaccine. And, I wish you could mandate some common sense. Unfortunately, you can't.
Health experts say the lack of any kind of mask or vaccine mandate could prove tragic in the future due to COVID-19's rapid mutation.
We have to worry, could there be development with these high numbers of replication? Statistically, could we develop a strain that's even smarter than our vaccine and or more infectious than even what we've got now? So therein lies the tragedy, both now and in the future.
Both officials are asking the public to step back from political statements and instead base their decision on science.
We talk about 84 people right now today are on a ventilator at a Ballot hospital. Yeah. And the majority of them are not vaccinated. It's sad.
Dr. May says health experts now have a better toolkit to fight this pandemic, but that those have not been implemented very well.
We know that 99% of deaths that are occurring right now could have been prevented by vaccine. We know that we could reduce our ICU census by greater than 90% if we had a vaccinated population. Now's the time. And take care of your neighbor.
Senator Lundberg echoed what many of our local lawmakers have been saying on social media lately, and that is no to any kind of COVID-19 related mandate. Live in Kingsport, Bianca Murray, News Channel 11.